I first began resistance training when I was 12 years old. I joined a local community center that had a weight gym that was open 3 times a week. Very often, when I would do my workout, I trained my whole body 3 times a week. And after the workout, sometimes I would go, they had with a steam room. They had a steam room. And sometimes I would go in the steam room. I wasn't sure what the steam room was doing for me, but the heat, the steam, it kind of felt good. It almost made me feel like I was recovering more rapidly from the workout. But the thing I remember about that is they'd have these older men would come in, sometimes not so older men, but they were older than me. They'd come in the steam room and at first glance, I had to rub my eyes because when the door would open, it would look like there was a grizzly bear coming into the steam room. These guys were so hairy that they didn't look human. They were literally had inches of hair all over their body. And I couldn't figure that out because, of course, as a kid, I wasn't a very hairy guy and I never became a hairy guy. But I just couldn't understand it, But this is a condition that I'm going to talk about today because basically I got a comment under one of my videos. One of the viewers of the video, he wanted to have information. He said that hair grows very rapidly all over his body. He wanted to know what the cause is and what he can do about it. So that's what I'm going to talk about today. That condition that he's talking about is called hypertrichosis. Sometimes it's pejoratively referred to as the werewolf syndrome. People who are film goers or people who like classic films might remember the werewolf. This was a human being who developed. I think when the full moon came out, if I remember correctly, he would turn into a werewolf, which was characterized by the very sharp teeth and kind of the canine-looking face and extreme hair all over his body. So somebody came up with the idea of calling hypertrichosis the werewolf syndrome. And by the way, there is a medical condition called the werewolf syndrome that involves abnormalities in blood where people who go out into the sun, they get a bad reaction. I can't remember it offhand. Maybe somebody watching this video who has a little bit of medical knowledge could write in the comments what this condition is. Porphyria, I think it's called. I don't remember. But I know that there's an actual condition where people are more or less allergic to sunlight. And they call that the werewolf syndrome, not to be confused with hypertrichosis. Now, the hair on the body, it's kind of curious because the body hair is promoted by dihydrotestosterone. Dihydrotestosterone is a metabolite of testosterone, and it's 5 times more active in regard to its interaction with androgen receptors, except in muscle. And muscle testosterone is the main androgen, which is why bodybuilders and athletes use anabolic steroids, which are synthetic analogs of testosterone. Strangely enough, some anabolic steroids are based on the DHT structure, but the structure is manipulated in such a way that these steroids do provide definite anabolic effects. In fact, some of the most potent steroids are DHT based. Unfortunately, while DHT causes body hair growth in the scalp, if you have the genetics for a condition called androgenic alopecia, also known as male pattern baldness, if you have inherited genes for that condition, and you take testosterone or anabolic steroids, which especially the DHT-based steroids, you will go bald. It'll stimulate baldness. What happens there is that the DHT affects the hair follicles, where the hair grows out of, and it turns hair, basically miniaturizes the hair follicles. So the appearance is that there's no terminal hairs, so you look like you have a bald head. Now, of course, when you take steroids, normally men don't usually start getting thinning hair when they get past 40. A lot of men. That's especially when the male pattern baldness gene kicks in. However, young men who take steroids can go bald even in their early 20s. I've seen quite a few cases of this. Bodybuilders 22 years old who've already lost their hair because they took the steroids that accelerated their male baldness condition. Of course, if you don't have the genes for male pattern baldness or androgenic alopecia, no matter how much DHT you produce, you're not going to go bald. Now, so the interesting thing, it's kind of curious that while DHT promotes body hair, it causes hair in the scalp to be lost. Anyway, let's talk about hypertrichosis. Hypertrichosis can occur in both male and female, men and women. In women, a lot of times it occurs with a condition called polycystic ovarian syndrome. And that condition, women tend to produce greater amounts of androgens, and they get higher testosterone levels. And the testosterone can be converted into DHT, and it causes them to have excess body hair. So that's one particular condition in women that can cause a type of hypertrichosis. Babies are often born with excessive body hair. I had a girlfriend, she showed me a baby picture of herself, and frankly, she looked like a baby ape. She had black hair. She was just a newborn infant. She had black terminal hair all over her body, a baby picture. But that was not really a serious medical condition. It's just something that happened. This is called, when it happens in a baby, the condition is called congenital hypertrichosis laginosa. Babies normally have fine hair. It's called lanugo. This is what happens when men lose their hair when they go bald. When the hair follicle shrinks, they're still producing hair. Because the hair follicle is miniaturized because of DHT, all they produce is lanugo, which is kind of little fine blonde hairs. And this is in most babies have this lanugo. But in some babies, the fine hair continues to grow on various places all over the baby's body, and that's considered congenital hypertrichosis laginosa. There's another one called congenital hypertrichosis terminalis. This one, the hair is unusually long and thick, and it can appear not only in the body but also the face. Then there's another kind called nevoid hypertrichosis. That's where excessive hair growth appears in particular areas of the body. Then you have, as I said, in women, you sometimes have a condition where they produce excess androgens, either because of polycystic ovarian syndrome, or for some reason, maybe they're, for example, a woman who uses, let's say a bodybuilder, female bodybuilder uses anabolic steroids, she can get excessive hair, facial and body hair growth. That's called hirsutism. This results in dark, thick hair growing in places where women normally don't have hair, such as their face, chest, and back. Sometimes these women actually grow mustaches. One of the ways of treating this condition in women is to give a diuretic drug called spironolactone, aldactone, which is an androgen receptor blocker. That's one of the ways hirsutism is treated in women. Of course, the most obvious way to treat that in female bodybuilders is for the women to get off the steroids. Although taking the steroids can also, in women, cause male pattern baldness, where women start to lose head hair or scalp hair the same way as men do. They can thin in the front or they can thin in the back. And that can happen even in young women who take large amounts of steroids. But those women, just like the men, would have to have genetics for androgenic alopecia. If they don't, no amount of steroids is going to cause them to lose hair on their head, but they could still get hirsutism, excessive hair on the body from using the steroids. Then there's something called acquired hypertrichosis, which is, that's not a congenital form. It usually happens later in life. It results in two types of hair, vellus hair or terminal hair. Excessive hair may grow in small patches or on all hair-growing areas of a person's body. Now, the vellus hairs, the follicles for these hairs are usually short. less than a third of an inch long. This is I meant to say this is the type of hair that bald men have. It's called vellus hair. It can be located anywhere but the soles of your feet, the backs of your ears, lips, palms, or on scar tissue. It could be pigmented or non-pigmented. Lanugo hair is very soft and fine, like that on the newborn baby's body. It has no pigment. It would be, in other words, if you see it, it kind of looks blonde. Has no color. There's no melanin. It's what gives hair color. There's no melanin there. And the terminal hair, of course, is hair that's long and thick and dark. The women with hirsutism develop stiff, dark body hair, usually on their face, chest, and back. Hypertrichosis can also affect your gums or teeth. It can cause some teeth to be missing or your gums to get enlarged. The causes of hypertrichosis aren't completely understood. So there's one kind of form of the disease that does run in families. It would be congenital or genetic. The acquired type of hypertrichosis has several origins. It could be from a condition called porphyria cutanea tartar. That's actually the medical werewolf syndrome. That's where your skin is very, very sensitive to light. This malnutrition can cause excessive body hair growth. An eating disorder like anorexia nervosa. Very often people with anorexia nervosa develop fine blonde hair all over their body. I've seen this in some women that had extreme anorexic nervosa. Certain drugs, like as I said, anabolic steroids, even the hair growth drug minoxidil, which was formerly used for treating high blood pressure, that can cause hypertrichosis. In fact, the fact that minoxidil causes hypertrichosis is what led to its use as a baldness treatment. They noticed that using minoxidil, when they were giving it to treat high blood pressure, the people using it started to grow hair. Their eyebrows would get thick and they'd start to grow hair all over the place. So they figured, well, if we put this in a topical form and put it on, let's say, male pattern baldness, it should help grow hair or stop male pattern baldness. And that's what it's used for to this day. It's used in a certain concentration in a topical form. But again, if you take it orally, it can cause hair growth all over your body. There's a cancer. Unfortunately, some people with cancer also develop hypertrichosis, excess hair. It can also hypertrichosis can occur with certain types of diseases like lichen simplex. That's where you have an itchy and scratchy skin. Using a plaster cast, let's say you break an arm or something, you have to put on a cast. You get excessive hair growth under the cast. Strangely enough, increased vascularity, which a lot of bodybuilders seek. In other words, the appearance of greater superficial veins, excessive vascularity. Believe it or not, that can cause hypertrichosis. But of course, bodybuilders most often shave the hair off their body anyway. So the congenital hypertrichosis langonosa, very rare. It's very rare. It doesn't happen. Hirsutism usually occurs in about 7% of women in the United States. Usually, again, related to a disease. It can happen from using steroids. Hypertrichosis doesn't have any cure, but you could, if you avoid certain medications such as minoxidil, I'm talking about oral minoxidil, you have a greater chance of not acquiring hypertrichosis. There are a couple of suggested treatments: shaving, chemical epilation, where you put on these stuff that removes hair, waxing, plucking, hair bleaching. All of these are suggested treatments. They're just temporary solutions. They can cause skin irritation. So there's the long-term treatments include electrolysis, which actually gets rid of the hair, laser surgery. With electrolysis, it actually destroys the individual hair follicles with small electrical charges. Laser surgery involves the application of a special laser light over several hairs at one time. Hair loss can often be permanent with some of these treatments, although you might need a couple of sessions to complete the job. So, what else can I say about this stuff? Let me see. hairy backs. It was, what about hairy backs? That's what I noticed in that steam room. That could be caused, in women it's hirsutism. And again, in women it's called by hormone imbalances, Cushing syndrome, which is an excessive release of the hormone cortisol, adrenal gland disorders. I mentioned polycystic ovarian syndrome. What else can I say? I think that's about really covers it. So again, I wanted to give a little information about this because a viewer requested it. But it's very interesting, really, in retrospect, when you think that extreme vascularity, which is a highly sought after property in competing bodybuilders because it makes them look more muscular or defined, can actually cause hypertrichosis. I'm not sure why, but apparently that's what the medical literature says. But again, you probably wouldn't never see this in a elite bodybuilder because they shave all their body hair off. So I think that's about it for hypertrichosis. The greater problem, as everybody knows, is hair loss rather than excessive hair growth, especially hair loss on the head, male pattern baldness or androgenic alopecia. There's a lot of treatments for that. I saw a video, I don't want to mention this guy's name. I mentioned it in previous videos, but I'll give you a hint. Everybody will know what I'm about to say. This is a guy who uses very extreme methods to keep himself young, and he thinks he could actually cause an age regression. But he's produced or posted several videos on his hair loss prevention routine. He claims to have reversed his gray hair loss back to black. If you look at him in videos, his hair is a very unnatural color. I think he denies using hair dyes. Maybe he doesn't. I don't remember. But it's very obvious he dyes his hair, which accounts for his loss of gray hair. But he does a lot of crazy things to prevent hair loss, such as microneedling, which doesn't work. He puts a laser helmet on, which I have doubts about. He does use a couple of things known to either arrest or stop hair loss, such as topical minoxidil, topical finasteride, and his hair loss formula, which he has, which was produced by a compounding pharmacy, can't buy in stores, actually contains minoxidil, finasteride, and a couple other things like 1% caffeine. Some studies indicate caffeine applied topically can stop hair loss. I wouldn't rely on that. Honestly, I wouldn't rely. I don't really believe that's really effective. He also throws in stuff like melatonin, a couple of other things, which have very questionable usage for stopping hair loss. To me, the only two active ingredients he has in his hair formula are finasteride and minoxidil. They both are effective in stopping male pattern baldness. They work by minoxidil stimulates, it possibly can increase the activity of hair follicles, makes causing your hair to grow. Finasteride blocks DHT, which is the basic cause of male pattern baldness. So I'll leave it at that. If you want more information on nutrition, exercise science, anti-aging research, supplement science, which supplements work and which ones don't. Unlike 99.9% of people who post videos on YouTube, I'm not aligned with any supplement company. So you'll get the truth from me. I'm going to tell it as it is in Applied Metabolics. I will expose fake supplements. I mean, the FDA, or Food and Drug Administration, which is supposed to monitor food supplements, they don't have the manpower to do it. And the only time they step in and go after, let's say, a food supplement manufacturer or seller is when there's a large number of reports related to adverse effects from any particular supplement, or if a supplement contains an actual prescribed drug, then they go after them. But other than that, it's no man's land. In other words, a supplement company could sell you fake supplements, underdose supplements, supplements that don't work. I expose all of this stuff in Applied Metabolics, so this is where you get the truth. I also cover effective fat loss techniques, women's health and fitness, hormone therapy, Applied Metabolics is about anywhere from 35 to 45 pages every month. It's no ads, pure evidence-based information that includes my over 6 decades of constant study and experience. I don't think there's anybody who publishes a digital publication that can match that record. It's at you could subscribe at www.appliedmetabolics.com. When you subscribe, send me an email, and I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on exercise, nutrition, and general health. I also have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they might have read in Applied Metabolics or anything related to nutrition, exercise that I can help them with. I will answer their question as an appreciation and as a sort of bonus for their subscription to Applied Metabolics. So again, it's www.appliedmetabolics.com. Subscribe today. If you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. Thank you for listening.